Okay, so I'm Kelly Poppaw. I teach the Finding Dysfunction course. One of the main concepts that we talk about in this course is the Hypo-Hyper compensation model. We apply that to joint and muscle and compensation. I'm going to show you a technique on Tony that we cover as far as joint dysfunction and applying the Hypo-Hyper compensation model. When patients come in to see us, a lot of times when they talk about shoulder pain specifically, they're kind of pointing around here around the GH joint, the glenohumeral joint. That joint is a ball and socket joint, right? So it has a lot of bandwidth to move, and it ends up being the joint out of the whole shoulder complex that just is more of the hypermobile joint. It tends to be more hypermobile, which is one of the reasons why it ends up being increased pain there. So the other three joints in the shoulder complex are SC, AC, and then ST, or scapulothoracic joint. All three of those joints must move first before the GH joint moves. So if you have any hypomobility at the SC, AC, or scapulothoracic joint, it can lead to that adjacent GH hypermobility and therefore leading to pain. So one of the things that we teach in class is look at the SC joint first. And we do that through both a posterior glide and an inferior glide to try to restore flexion or overhead reach. Okay, so that's what I'm going to show. So I'd bring my thumbs in from the outside of the clavicle, find the medial clavicle, okay? And then I'd place my thumbs right over top of his medial clavicles right at the SC joints. If I'm going to mobilize the right side, then I like to use a key grip. You could also use your thumb over thumb or the thenar eminence, whichever one you prefer. But right now I'm just going to do thumb over thumb and then mobilize in the posterior direction, getting right over top of him. Okay. You can sustain or you can oscillate. So off of his body, it just looks like this. Okay. So that's the posterior glide. You also can do an inferior glide, which is actually the more important one for flexion. When we do the inferior glide, I like to get right at the level of his head. But then one of the things that I like to teach too is I use my opposite hand for his opposite arm. So if I'm mobilizing his right SC joint in the inferior direction, then I'm going to use my left hand on his right clavicle. Okay, and that's just because of the angle of the manubrium at the sternum. If you mobilize it with the same hand going down and inferior, then you're actually just going to hit bone. Okay, but if you use the opposite hand, you're going to go more in line with the joint plane and you'll get a little bit more motion there. Okay, so I'm going to hook on with a key grip here and then right on the top of the clavicle, going in this direction towards his right hip, essentially, inferior glide. Okay. You can always add in some motion with this too, so I could have him flex his arm overhead. So reach overhead, Tony, all the way up overhead as I'm maintaining that glide in the inferior direction. Okay. And again, I'm coming in from the opposite side.